Welcome to Hello Doctor Talks. Today we are going to discuss about radiation therapy. To discuss more on this, today with us Dr. Anusha. Dr. Anusha Mandava, consultant radiation oncologist at Star Hospitals, Hyderabad. Doctor, what is radiation therapy?
Radiation therapy is a non-invasive procedure wherein therapeutic X-rays are used to target tumor tissue. So diagnostic X-rays uses kilovoltage range X-ray beams, and in radiation therapy we use megavoltage beam which has deeper penetration.
Doctor, what is the intent of radiation therapy in general?
Radiation therapy can be delivered with various intents. So primarily it can be given as a radical treatment. Examples of this would be a cervical cancer wherein radiation and chemotherapy together forms the primary modality of the treatment. It can be used as a neoadjuvant therapy. Example of this would be a rectal cancer wherein radiation is delivered prior to the surgery so that the surgical excision becomes easier. It is easier to get a good margin during surgical resection, or it can be used after a surgery such as in oral cavity cancer. So the last intent would be palliative intent, wherein we are mainly doing a symptomatic treatment. If a patient presents to us with bony pain because of the tumor metastasis, we will target these painful bone lesions so that patient is symptom free. So this is the intention of palliative treatment. Apart from the malignant tumors, we also can treat benign conditions such as trigeminal neuralgia, AVMs and others with radiation therapy.
Doctor, what is the role of radiation therapy in breast cancer?
Breast cancer being the most common cancer in Indian population, it is important that we know the role of radiation therapy in management of breast cancer. So in early stages of breast cancer, patient can either go in for lumpectomy or mastectomy. So post lumpectomy, depending upon the characteristics that we see in the post-op histopathology, patient can receive whole breast radiation, that is the remaining breast that is left after the surgery receives a particular dose of radiation. In very limited number of patients who have good post-operative histopathological characteristics, we can also do what we call partial breast irradiation, wherein only the adjacent part of the lump will be treated with radiation to a particular dose. This is in early stages who undergo lumpectomy. So patients in early stages who go in for mastectomy usually would not require radiation therapy until and unless there are certain features of post-op histopathology, high-risk features. In locally advanced disease wherein the tumor is larger in size or it has spread to the lymph nodes, radiation therapy is definitely indicated, and we'll have to target the chest wall as well as the draining lymph node sites, that is the underarms as well as the neck. In metastatic cases, wherein patient might present to us with an ulcerative breast lesion, or if they have bony metastasis, so we will address whatever symptom they are presenting to us. To prevent further worsening of the ulceration, we can do palliative radiation therapy to the whole breast.
Doctor, what are the various advances in management of breast cancer?
Over the past few decades, there is improvement in all the three modalities of treatment. Surgery wise, when we look at it, it has progressed from radical mastectomy, wherein the breast and underlying muscles used to be removed, to only removal of the lump with adjacent margin, as well as removing very isolated lymph nodes. When we look at the chemotherapy part, we also have like shift from toxic chemotherapy regimens to advanced targeted therapies, and also better ability to deal with the side effects. When we come to radiation therapy, earlier we used to treat patients with 2D technique which had higher side effects. Now we have advanced techniques wherein we are treating with conformal radiation therapy, targeting only limited to the chest wall and the regional lymph nodes wherever indicated. To address the issue of reducing the lung irradiation, we also have a technique called deep inspiration breath hold. wherein a patient is asked to hold the breath in a particular phase of respiration and radiation is delivered only in that particular phase.
Doctor, how many days of treatment required for radiation therapy?
Radiation therapy is ideally delivered in the range of 3 to 4 weeks. Earlier, we used to treat to 25 fractions, but now the protocols have changed wherein 15 days fraction is the standard of care. We also have recent trials which show that 5 days treatment is equally efficient.
Doctor, is the whole breast irradiated?
During radiation therapy, especially in early stage breast cancer, we have two options available. So, a whole breast can be irradiated to prevent the recurrence, or in very select cases, only partial breast can be irradiated.
Doctor, what is the process of radiation therapy?
So, radiation therapy has various steps involved within it. So, the first step is pre-planning, wherein we immobilize the patient in a particular position. Like if the left breast is operated, we usually advise the patient to raise the left arm, turn the head towards right, and we immobilize the patient in that particular position with a thermoplastic cast. Once this is done, we do a CT scanning, which is called a CT simulation in that same position. This is pre-planning. So we also have planning, that is the step 2. Step 2 is a planning process wherein the images obtained by CT simulation are used for contouring the target organs as well as organs at risk. Based on this, our physicists, medical physicists will provide a radiation therapy plan. We evaluate this plan for adequate tumor coverage as well as reducing the dose to the normal structures. Once this is approved, the plan gets transferred to the medical linear accelerator which delivers the treatment. Step 3 is the delivery of the treatment by medical linear accelerator. Here, the patient is positioned every single day on couch with the same thermoplastic mask that we used in step 1 in the same exact position. So, patient treatment delivery happens in that particular position from day 1 till the completion of treatment.
Doctor, what are the side effects during the radiation therapy?
So, the side effects, particularly in patients who are receiving radiation therapy to the breast or the chest wall, include either early onset side effects or late. These can be the skin changes or dry cough or difficulty in swallowing or cosmetic related issues.
Hope so we have covered all the questions related to radiation therapy. If you have still doubts, kindly mention in the comment box.